Hello fellow colleagues. Today me and Holly will be discussing craniosacral therapy with you. According to Tabor's Cyclopedic Medical Dictionary, craniosacral therapy is a form of massage that purports the use of manipulation of the cranial bones and the sutures to redirect the flow of cerebral spinal fluid. A craniosacral therapist uses simple, non-invasive, light touch techniques on the cranial bones to redirect the cerebral spinal fluid. Although there is very little research supporting craniosacral therapy, there are a wide variety of indications for this technique. People obtain dural or meningeal tube restrictions just like they obtain a fascial restriction. Craniosacral therapy helps improve the pathway of cerebral spinal fluid to move throughout the spine to properly nourish the tissues of the central nervous system. Some of the indications of craniosacral therapy are migraine and tension headaches, as well as pain in the TMJ, face, neck, shoulder girdle, and lower back. According to the University of Pittsburgh Medical Center, general body problems like fibromyalgia and chronic fatigue syndrome can also be helped with the use of craniosacral therapy. Problems with alertness, concentration, memory, anxiety, and stress-related problems can also be indications for craniosacral therapy. During the 10-step protocol, which we will discuss shortly, different problems can indicate for a different technique. A frontal bone lift can help with headaches, migraines, sinus problems, cerebral palsy, and a decreased smell and taste. A parietal bone lift can help with headaches, mini strokes, motor problems, and sensory problems. A sphenoid bone compression and decompression can help with vision, headaches, and endocrine dysfunction. A sphenoid bone compression and decompression can help with vision, headaches, endocrine dysfunction, depression, glaucoma, low back pain, scoliosis, autism, and even seizures.
Okay, so now we're going to discuss the 10-step protocol, which is 10 steps that usually occur in 10 treatments, no more than 2 times per week. The steps are still point, diaphragm release, sacral technique, dural tube rock and glide, frontal lift, parietal lift, sphenoid compression distraction, temporal release, TMJ, and still point, followed by cranial pumping. Each phase in this 10-step protocol will achieve different benefits for the client, and the craniosacral therapist can use their knowledge of the 10-step protocol and their knowledge of the problem by adjusting accordingly to achieve the desired benefits. There are many benefits of craniosacral therapy, like decreased perception of pain due to the movement of spinal fluid, which removes the toxins from the central nervous system and can now function better. Soft tissue release. This happens by relaxation of the whole body, such as the organs, the muscle, and the central nervous system due to the soft tissue techniques. Structural decompression. By moving the cerebral spinal fluid throughout the central nervous system, there can be a decrease in the articular surface irritation. This is the technique that would be used to help people with scoliosis or other postural problems. Structural mobilization. This can occur by stimulating the nerves and therefore stimulating the endocrine system, and it's helped to improve the hormone function. Fluid exchange, which is the movement of cranial bones, which moves the cerebral spinal fluid into the central nervous system, and this enhances the nutrition, circulation, and lubrication of the entire central nervous system. This occurs similar to joint mobilization and helps improve the joint by moving synovial fluid into the joint capsule. Energy exchange, and somato-emotional release, which is the bringing up of emotions and releasing them by using craniosacral therapy techniques. Some of the assessment findings that may indicate the use of craniosacral therapy may be that if you have a positive slumps, valsalvas, or limites, which is indicating a meningeal irritation, so craniosacral therapy can be very beneficial for that, just improving the length and fluidity of that, as well as if there are frequent headaches where there aren't any palpatory feedback or trigger points or muscle tension causing the headaches.
Okay, so although craniosacral therapy uses light touch during its treatments, there are some contraindications that the therapist needs to be aware of. Some contraindications include an acute stroke, an open head wound, a hemorrhage, an epidural leak. If that's the case, you need to wait 24 hours after the epidural leak. An unhealed fracture to a vertebrae, a brainstem herniation, a recent spinal tap, and in that case as well, you also wait 24 hours before treatment. An Arnold-Kahari malformation, which is the incomplete formation of the foramen magnum up in the cranium, an acute aneurysm, pregnancy, and a brain injury. These contraindications are in place due to the movement of cerebrospinal fluid. By moving around the fluid in the central nervous system, one must be careful not to cause any further damage. Craniosacral therapy is not a regulated profession in Ontario. However, if one wishes to continue their education in craniosacral therapy, the hours for training count towards the continuing education units of the CMTO. The closest training location for craniosacral therapy is in the Craniosacral Therapy Centre in Toronto, Ontario. The program is taught by Robert Harris. Robert Harris is a registered massage therapist as well as a craniosacral therapist. As a registered massage therapist, you can use these techniques in your practice only after you finish the advanced program at the Craniosacral Therapy Centre. The program consists of 60 to 62 hours that is spread over of any 10 days, not necessarily in a row. The cost of the full program is anywhere from $2,000 to $2,120. Once you complete the advanced program, you can specialize with a TMJ, visceral, or pediatrics portion of the craniosacral therapy.
So a randomized control trial was put together for patients that had fibromyalgia. There were 92 people that were split into an intervention group and a placebo group, and the intervention group was the one receiving the craniosacral therapy. They were looking to see what they could do as far as decreasing the pain and some of the normal tender points associated with fibromyalgia. And it was noted that after a 20-week therapy treatment of craniosacral therapy, there's a significant decrease in the tender points such as the occiput, the left trap, the right supraspinatus, and the left greater trochanter. As well as a year later, they still showed significant decrease in the tender points and pain experienced with normal fibromyalgia. Even though the placebo group did still experience some decrease with their tender points as well, it wasn't anywhere significantly as much as the intervention group. So through this study, it had been discovered that craniosacral therapy can provide a lot of benefits for fibromyalgia patients and their pain and some of the tender points that they experience.